Hello, thank you for tuning in to Channel 5. Our top story tonight, bladder cancer on the rise and needs public attention. Did you know that bladder cancer is the fifth most common cancer in the United States and is the most expensive to treat on a per patient basis? Despite its prevalence, morbidity, mortality, and associated cost of management, bladder cancer remains grossly underrecognized as a public health concern and is underfunded scientifically. 5-year survival rates for patients with prostate or kidney cancer have improved tremendously in the past 30 years. Progress in bladder cancer is stalled. A renewed interest from the clinical and research communities are raising the profile of bladder cancer. The survival rates for bladder cancer are relatively low in the early stages, and then the survival rate decreases as the stages go on. So during the stage 0, which is the beginning, it's a 98% survival rate over 5 years, which means that the patient has to live 5 years or longer in order to count as living. So the stage 0 is at 98%, the stage 1 is at 88%, stage 2 is at 63%, stage 3 is at 46%, and then stage 4 is at 15%. Stage 4 is very advanced and is a very aggressive time of cancer. And what happens and what makes it so hard to treat is that it metastasizes. So what that means is it spreads through the blood system or the lymph nodes and travels throughout the body in order to gain access into other organs and other tissue. And this is shown in this picture. If you look at the last one, it shows as an arrow up to the blood vessel and the lymph nodes, which is showing it metastasizing. So some things that we can do to help bladder patients is to use a cystectomy, which is also known as a surgery but with robotic arms. So what this does is that instead of using surgery to remove tumors by people, it does it by robot. So what the benefits are to this is that the robot makes smaller incisions into the tissues, which makes the recovery and the immune system work less in order to fight off infection. Because when people use a surgery, it makes a larger incision, which is more chance for infection, which makes this a benefit for bladder patients because it really helps their chances of recovery and being able to sort of fight off the cancer by their immune system. The second one is called photodynamic therapy. It's a relatively new kind of therapy, and it is used in the early stages of the bladder cancer. So around stage 0 and stage 1 is where it would be used. It's a drug that's inserted into your bloodstream and then used to kill cancerous cells. It does kill normal cells, but the amount of normal cells it kills is almost nothing compared to chemotherapy, which is what is used by most doctors and hospitals. So what the problem is and the benefit towards this is that it doesn't kill as many normal cells as a chemotherapy would, because chemotherapy is very, very aggressive and it kills all fast-growing cells, or such as hair cells, skin cells, so all the cells that are rapidly dividing. Therefore, it's killing a lot of normal cells, which makes your body very sick and your immune system hard to fight off other infections, such as the rhinovirus, like the common cold. It makes it very difficult to fight off. Some of the future hopes that are in this bladder cancer is to help find a drug that would kickstart the immune system. So what it would do is it would the immune system would be able to recognize the cancerous cells in the body, and it would be able to fight back. And in this way, we could use or alter a gene in order to create this cure, and it would we could also use some sort of vaccine that would help do this. That a chemical that would help inhibit the growth of cancer cells before it happens or after before it comes back. And we will be back to do weather after the commercial.